I have arthritic knees and my doctor says that I've just got to live with it and take some anti-inflammatories. Now I hear this quite a bit and it's very disappointing because it's not evidence-based practice. Now we know there are plenty of things you can do for osteoarthritis. Not least exercise therapy is really good, obviously prescribed by a physio, tailored to your individual needs to build up your function, lower your pain, build your tolerances up. So you can basically live a more pain-free and normal life. Now obviously it's not necessarily changing the osteoarthritis, but it's about the pain and the function, which don't always correlate with the arthritis itself. Now what about the medication side of things? Here we said the doctor was giving you anti-inflammatories, which is a common medication given for any inflammatory based type of issues, and obviously osteoarthritis actually may not be overly inflammatory, but obviously that is the treatments that are often utilized. But is it bad to take anti-inflammatories for osteoarthritis? So here we'll look at the evidence behind the question of, should you take anti-inflammatories for osteoarthritis? Is it actually good for you or is it actually bad for you? Now here is a longitudinal study where they were looking at the role of non-steroidal anti-inflammatory drugs and the association between osteoarthritis and cardiovascular disease. Now, as we said before, non-steroidal anti-inflammatory drugs are a common medication given for people with osteoarthritis. Now, while they do reduce pain in the short term, what do they do in the long term? Should we be taking these type of drugs all the time? Because remember, osteoarthritis is a chronic long-term condition. So what did they find in this study? So they found that non-steroidal anti-inflammatory drugs did have an association with increasing cardiovascular risk in people with osteoarthritis. Now obviously there are many factors involved in cardiovascular disease, but they did try and work this out and basically did come to this conclusion that yes, it does appear that non-steroidal anti-inflammatory drugs in the long-term use in osteoarthritis patients have got an increased cardiovascular disease risk, which is not good at all. Specifically, they estimated that 41% of the effect from osteoarthritis on cardiovascular risk was actually down to the non-steroidal anti-inflammatories. And for secondary outcomes, the non-steroidal anti-inflammatories had a 23%, 56% and 64% effect on congestive heart failure, ischemic heart disease, and stroke, respectively. So if you can't take non-steroidal anti-inflammatory drugs, or maybe it's not a good idea to, what can you take instead? Now we obviously spoke earlier about physio, about hands-on therapies, about exercise therapies, lots of things that you can do to improve the function around your osteoarthritis and the pain of it. But what about taking something? Can you take something else? Now, yes, the answer is yes. We have done videos before on the research, and the research is there and is clear that things like turmeric are very, very useful. They have a natural anti-inflammatory effect. They have been researched comparing against the non-steroidal anti-inflammatory drugs. They're either equal to or better than in certain studies for osteoarthritis. So this highlights that turmeric is really useful. Turmeric combined with black pepper extract, so purpurine, is even better, makes it more absorbable. It's obviously antioxidant. So there are lots of benefits to turmeric, so it doesn't carry the side effects and the cardiovascular and the stroke and all the other risks that are associated with long-term use of non-steroidal anti-inflammatories. So if you were going to try something medication, wise, it would be turmeric. So instead of reaching for your naproxens, your ibuprofens, your diclofenacs or whatever else, try turmeric instead. What have you got to lose? But I would also say you want to come at it from all points of view. So you want to look at the psychology behind why pain is worse in some people, sleep, nutrition, obviously supplements like turmeric, looking at exercise, looking at weight. There's so many things that can improve it. Why would a doctor say you just have to live with it and just take these drugs? Just not a very complete way of looking at things. And this study highlights that it may actually be dangerous potentially in people for cardiovascular disease and other things besides. So don't take the non-steroidal anti-inflammatories. Instead, come at it from all them other facets. It's a much better approach to your management of osteoarthritis. So anyway, that's it for this video, and I'll see you next time.